improves. Because this thing has a tendency to not be even sometimes.
Looks like it's going to be a busy day today. We got a couple surgeries lined up, so there'll be some interesting stuff. Let's take a look at Fiona. She's already had her pre-meds, so she's snoozing. What do you say, Fifi? What are you doing, girl? There we go, baby. Are you awake? Are you awake? Yeah, you're sleeping pretty good. So she has had her pre-medication. It's a morphine type pain medicine and a sedative to help her relax. It takes away her anxiety. It makes her breathe easy. It preemptively treats her pain. So she's going to have a tail amputation surgery today. And one of the things we're going to watch for with her, because she's an English bulldog, you can hear her snoring. And when they start to go to sleep like that, they can't control their muscles of their throat, and they have a lot more snoring and difficulty breathing. So we'll keep her on the oxygen. We'll pre-oxygenate her before we start the procedure, and we'll keep her with the endotracheal tube fully oxygenated until she recovers. So that's something that we'll watch real closely with her. All right, this is Fiona's tail. Get a closer look here. She has, you can see her, this is the hard part of her tail, and it curls around like this, and then it makes a curly cue. And so it should be like a corkscrew, but unfortunately it's curling back. See, this is all hard, this is bone. These bulldogs have a crooked little tail, and this bone is curled back, and it's pushing on herself, and so we're getting infection in here. This tail needs to be out like this. So we're going to have to amputate her tail. We have to be careful of her rectum here, because we don't want to interfere with the control of that. We want this infection to go away, so we have to amputate her tail somewhere down in here, and then cosmetically close this skin and try to get it to heal in this area where there's a source of infection. So it's a cosmetic surgery, but it's a medical procedure as well. So we'll get an update. It's going to be hard to see once you're in surgery. It's going to be messy, but we'll show you the after pictures. All right, we finished with Fiona's surgery, so take a closer look here. She's still bleeding a little bit, but we had to amputate her tail, and then we had all this extra skin. We had to remove the infected skin from here. And we have all these flaps and grooves that we had to close back. So the goal here is to have nothing that's going to get kinked up and cause a problem, and I think it looks clean now. She's got a little nub even, so she's going to look good once the hair grows back.
Hey. 1 to see.
No.
1 to see. We have 13 to see. This is Glenn. This is one of the guinea pigs that we checked last time. He had looked okay, and we stopped his medication, so this is just like supposed to be his last recheck before maybe he can go to a home.
1.
Okay. This is Clark. He is a new...
So it's pretty
What you doing, Tim?
Hey, I'm working on a little Maltese who's nervous. He's here getting groomed today, and he's real anxious at home. He has a thunder shirt that really helps him out a lot, but he's still nervous. So Dr. Rourke saw him today, and we have this adaptable collar that really helps out nervous, stressed out dogs. It releases pheromones they get from their mother when they're puppies. And it really calms them. We've seen a lot of help with it here at the clinic, especially with cats and nervous little puppies coming in for the first time. So it seems to work really well for a lot of dogs. It's just a collar that goes around their neck, and it releases those pheromones, and it really seems to help out a lot. So we're going to try it with Delbert, and hopefully it works out for him as well.
Cool.
I have really grown to love these guinea pigs.
All right, sweetie. Let's try and get some of this discharge, okay?
What a good piggy.
Yes. Good job. All right.
That was so good.
So
Eye infection there.
he does. He's got some cataracts, and so he's been getting this kind of white milky discharge. We think that he's probably got some dental issues potentially too. So we're going to start with treating his eye, and then we're going to go from there on another date and look at his teeth after he's feeling a little bit better.
Watch the...
Yeah. As I'm drinking Red Bull. So we're just doing a radiograph on this handsome boy here. We see there's a mass right here. And we also have some osteomyelitis, and we know it's in the mandible and the bottom jaw of this guy too. So we're gonna check that out as well. But down.
How do you want me to measure it? Like this?
We're gonna try and put his head as close to that board as we can. So yep. There you go, and then close it down.
Close. Because this thing has a tendency to not be even sometimes. It's about a 6. Lower our lights just a little bit.
1, 2, 3. All right, and get the second one.
Oh,
Yep.
We're
two.
gonna put one on the top,
Sorry,
one on the
sorry.
bottom.
No, perfect. All right, now I got him.
You got
Yep.
it?
All right. Now I should have gloves on technically, because I'm gonna be in the beam.
Grasp anything.
Let's see if I can grasp.
I feel like I'm Homer Simpson. Alright, you need him oblique.
Yep. And yeah.
I love you.
You don't even know him when you love him.
I just love him.
Oh.
Are you so cute?
He's real nice.
I love you. Welcome to the family, bud.
You're probably better off to grab his elbows. Yeah.
Okay.
So Jumpy is not feeling well, so we're gonna get some blood from her. Try to figure out what's going on. Good girl, Jumpy. Give me just another second, okay?
Good job.
Good girl, Jumpy.
You can let go of her feet. Thanks, Tyra. Great job.
Good girl, Jumpy. Alright, so Jumpy can go back to mom and just tell her it'll be maybe 30 to 45 minutes on that lab work.
Excellent job.
And we'll go from there. Thanks, Emma. Tyra, can you get that door for Emma, actually, please?